So my name's Tyler. I'll be looking after you guys this season. Concussions are primarily about 80+% of my practice is kind of what I do all day long. So I run a concussion program. So welcome you guys, since you guys are all new. So we work with pretty much every league team you guys can think of around. You name it, we see them. So this time of the year is a huge time for baseline testing for us, okay? So pretty much in the months of September and October, we'll be testing hundreds and hundreds and hundreds of kids. So with you guys as the Raiders, this is kind of your new welcome thing today, okay? This year, if you guys have any injuries or anything like that, we do offer a 24-hour urgent care center for you guys. So we are open 7 days a week. So if any injuries happen, you guys just call us and we'll get your kid in pretty much within 24 hours, part of the program, okay? So we do physio, chiro, massage, osteo, you name the service. We do medicine, we handle that, okay? We have 3 locations across the county. We have 2 locations in Paris, and then we also have a location in Brooklyn. So this year, you guys are doing baseline testing with us. How many of you guys in the audience today have had a concussion before? Okay. Okay, there's a lot of slow hands there. Okay. It's okay. You know, most of the groups that I do, I would definitely say at least 70% of my audiences have concussions or had some time in their life, okay? I myself have had one as well, okay? So you guys are doing U11 tonight, I believe, right? Okay? So as you guys can see, you guys fall into the first category here. You know, when we look at percentages every year, typically my teams that are 15 to 20 are our more high-risk groups that we see. But obviously, below the age of 15, about 40% of the kids that we see are pediatric, okay? One of the biggest trends, though, which is kind of interesting for our parents is I would say, you know, in the last couple years, that percentage is actually about 50-50 now, okay? Before it was, you know, the 18-year-olds playing hockey, they're rougher, they're doing contact, all that kind of stuff. But in today's world, it's about 50-50. Why do you think we're seeing so many young kids more than ever? You know, why do you think we're seeing these 11, 12-year-old kids? You know, why is this increase going on? Okay? The answer is programs like your guys, okay? You know, competitive rep teams. You know, how many days a week do you guys play right now with the Raiders? Okay? 5 days a week? How many days do you guys play?
I think 4.
4 or 5? Yeah. Okay, so it's a lot, okay? So the thing is that, you know, when I was 11 years old, we'd have 1 practice and 1 game a week, right? But now we're playing at such high levels at younger ages. So therefore, our injury rates are definitely going up because of that, okay? So what do you guys think the worst sport is these days? Okay, and this is really good news for all my hockey teams, okay? What do you think the top 3 sports are that I see every day? Football, okay? Hockey, okay?
Lacrosse.
Okay, lacrosse is a good one. That's good, yeah, for sure. You know, lacrosse is really cutting edge now. You know, lacrosse is such a popular sport from 5 years ago, right? So hands down, football is #1. And as you guys can see, basketball is actually #2 and soccer is #3. So a lot of people are quite surprised when they're like, where's hockey? And the interesting thing is for you guys, and this is a very positive thing is hockey is actually a very small percentage of what we see compared to other sports. Okay? About 2% actually of all the people I see. The biggest problem with hockey, and I say it's not the sport, hockey's fantastic. The thing is you guys play a lot of games. So guess what? More injuries are going to happen. Okay? But it's not the sport, it's just the frequency. Okay? But yes, football is definitely #1, basketball is actually a big one at #2, and then soccer is actually #3. Okay? So, what is a concussion? Okay? The biggest thing I always tell people, okay, and I had a parent ask me this today, is concussions are not structural problems, okay? There's no tearing, bleeding, bruising, anything like that, okay? So if you go to the ER tonight and get a CT of your child's head, it'll come back negative 99.9% of the time, okay? It's not a structural problem. What it is, though, is it's a blood flow and energy problem. Okay, did you guys kind of know that? Anybody kind of know that? Kind of cool, right? It blows people's minds because I literally had a lady this afternoon and she goes, you know, I said her son's fine, he doesn't have a concussion or anything, and she goes to me, you know, should I just go to the ER tonight and just get a CT? And I said, no, absolutely not. And we'll go over this why later, why, you know, there are some people that I'll send out, but it's very, very small number, okay? But remember this, when we have concussions, we have two phases that every single person goes through. Every concussion I see, we go through these two phases. The first phase is called the excitatory phase, which lasts about 3 days. And then after that phase, up to about 30 days, is called the depressive phase. What happens in the excitatory phase is after that shaking of the brain, our brain kind of goes, what the heck just happened? A thing called calcium rushes into all our little cells, and we start using energy up like crazy, okay? So the brain kind of panics. The problem is though, guys, is that if we start using energy up like crazy and we get a drop in blood flow, what happens? We eventually run out, okay? So during this excitatory phase, we start using energy like crazy, our brain kind of goes in overdrive, but by about 72 hours or day 3, we crash, okay? So it's kind of like that iPhone without getting it plugged in. And then we enter into this depressive phase, okay? So I always, and this is my recommendation to you guys this season, okay? If your son or daughter, okay, runs into the boards and you go, wow, that was a good one, okay? You know, I had a kid today and they were like, he had no concussion, it was great. But the thing is the mom was like, she was super worried about this kid because he went head first in. All the parents were like, oh my God, this is crazy, you know, big problem. And they're like, what should we do? When he came in, he was totally fine today. He had no symptoms from yesterday's collision, none. But what did I do? As I said, because of these two phases, we always wait with every athlete at least 72 hours before we start any process. Because we want to make sure that that kid goes through that first phase and we kind of know how or she is going to be doing, okay? After that 72 hours, that's when we can start to reintroduce things like school or work or anything like that. But those first 3 days, always, 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 guys, do not put your kid back into play. Wait that 72 hours out, okay? Very, very important. When I drew this graph here, as you can see, I have 2 lines, one on the top and one on the bottom, okay? The problem is, guess what, guys? If you get hit again in that first little vulnerable period, what do you think happens to someone's brain, right? Do you think it's a good thing or a bad thing? It's a bad thing, okay? What do you think is going to happen to that recovery? It's going to take longer, okay? So very, very important. Wait your minimum of the 3 days before we start to do stuff, okay? Key. The big thing with concussions, 80% of the time at least, by day 30 or 4 weeks, people are feeling typically pretty good, okay? Recovery for most concussions within 4 weeks is pretty successful, okay? So, any questions at all so far, guys? Pretty good? Cool, okay. So, concussions, all right? What do you guys think like the top 5 concussion symptoms are that people feel? Nausea. Nausea's a huge one, yeah. Pat?
Maybe blurred vision.
Blurred vision's great, yeah.
Dizziness.
Dizziness, good, yeah, perfect. Cool.
Brain
Brain fog, perfect. The answer is any symptom that is not normal to your kid is and can be a concussion symptom, okay? Concussion symptoms are extremely, extremely widespread, okay? The big thing with concussions is that they can be physical symptoms, like pretty much everything that you guys said, whether it's headache, nausea, vomiting, anything like that, blurred vision, you know, any of these physical symptoms, noise, light sensitivity. They can be cognitive problems. You know, your kid was an 80% student, and all of a sudden now he's barely passing. They can be emotional. Maybe the kid's behavior is a little different. Maybe they're a little bit depressed more than normal. Maybe suddenly they have anxiety, which they've never had before. And then of course, sleep problems are a huge one, okay? But concussions can be lots and lots of symptoms, okay? So this season, if something happens, don't be fooled by, oh, if my kid doesn't have a headache, they don't have a concussion. Because I see lots and lots of patients out there that don't get headaches, and that's okay. But they may get a lot of cognitive problems, okay? So remember, this season, it can be anything, okay? Anything different from what their normal is. And the big one for you guys too is if they have some pre-existing symptoms, guess what are going to be amplified when you get a concussion, okay? So if I have migraine headaches, how many people here have migraine headaches every week? I bet you at least, 30% of you, okay? If you get a concussion, what's going to be worse, okay? Those migraine headaches, okay? So, for the parents out here, okay, I get asked this every day, all right? Most of the time, guys, the best thing that you can do if your son or daughter gets a concussion is take them home and let them have a good night's sleep, okay? There's so many myths out there going, you have to wake up your kid every night, make them have horrible sleep, make sure, they're okay, all this stuff. The big thing, let them sleep. Let them get a good night rest, okay? When we sleep is when we heal, okay? The only time that I'll ever say to wake up your kids is if they have any of these symptoms, okay? So these are called red flags. Okay, so if the trainer or anything, is the trainer here? Okay. If the trainer's here, or for you guys as parents, if you notice any of these symptoms, this is the problem. You want to go to the hospital. But I'm telling you, this is less than 1% of the time this will ever happen. Okay? So things like worsening symptoms. And I mean like the kid is a 1 out of 10, and now he's at a 15 out of 10. Okay? Rapid worsening symptoms. Pupil changes is the big one, okay? Horrible headache that's definitely getting worse in a short amount of time. Repeated vomiting. And this is a big one that I see all the time in clinics. As contact athletes, vomiting is very, very common. If you've ever got your bell rung, guess what you do, right? You may puke. That's okay. But when I talk about vomiting, it's like a kid going for an hour straight. Okay, that's a problem. I had a girl that was at Canada's Wonderland who had a concussion, and she vomited for 6 hours straight at Canada Wonderland, okay? 6 hours. And just a little tiny girl got a concussion on a ride, okay? That's a problem. That's when we go to the hospital, okay? Obviously seizures, maybe if the kid's trying to skate to the ice and he instantly falls on the ground, is very clumsy, his motor skills are just not the best, okay? These are big ones. But if they're not having these severe symptoms, take them home, put them to bed, okay? Let them get a good night's sleep, okay? Very, very important, okay? So, the good news, that's very rare. The good news though is within typically 7 to 14 days, most concussions are feeling pretty good, okay? Which is a really great thing. Mostly in about 4 weeks, most concussions, about 80% of them, are pretty fully healed, okay? Day 30 with most people is green light, okay? The big thing though parents ask me is, when does that not always work? Or is why is my kid at 4 to 6 weeks and he's still having symptoms, okay? These are a variety of reasons why a concussion may take a little bit longer to heal than others, okay? So as parents, it's really important for us to kind of go, before the season, does my kid have any of these kind of risk factors? Has my kid had 5 concussions before the season? Okay? Is my son or daughter, do I have a son or a daughter? Females are known to take a little bit longer, okay? Has my kid had a long recovery with previous concussions, which is a huge one, okay? Our ages, our adolescent kids going through puberty because of hormones naturally take longer to recover from concussions, which is why females tend to take longer to recover with concussions. It's all about hormones, okay? We know in my concussion world depending on the cycle of a female, if she gets hit in basically the luteinizing hormone phase of her period, she will take longer to recover, which is crazy to think that, but that's the way it is. Factors, anxiety, depression, ADHD, any of these symptoms are well-known factors. If we have any of these, concussions are going to be amplified. If I'm a bad sleeper and I get a concussion, do you think I'm going to be a good sleeper after? No, right? If I have ADHD and my concentration and focus isn't really good on a good day and I get a concussion, guess what? Okay? So a lot of symptoms that kind of delay concussion recovery. Okay? Any questions about that, guys? Pretty good? Okay. So, what are we doing tonight? Okay, we're doing baseline concussion testing with you guys, which is amazing, very, very important. Like I said, even though hockey is actually not a super high-risk sport in my world, it's still very, very key to do these things. So tonight we're going to learn lots about your kids. We're going to do a whole bunch of things with them. But the key is it gives me a very, very good foundation of where we're starting off with your kids' health. Okay? Does anybody know why we do baseline testing? Why it is important? Do people think we do baseline testing to diagnose a problem? Or do you think baseline testing is used when we put them back on the ice for the first time? What do you guys think? Diagnosis or clearance? What do you think? In the background.
I think it would be diagnosis with the severity.
Okay.
Well, only because when my daughter had a concussion, we didn't have baseline testing done. So it was really hard for the physical therapist to determine, how bad were the symptoms compared because we didn't have one.
Yeah, nothing. Yeah.
Yeah, nothing.
Yeah.
So it took her longer because everything was compared to the first test after the concussion.
Yeah.
And then everything was compared
Yeah.
to that.
Exactly, and that's good, yeah. So for sure, severity is when we use baseline testing for 100%. If your kids' averages today are like 80% across the board, and they come in at 10%, we know they are having a larger problem, for sure. The big reason we actually use baseline testing though, guys, is I've obviously treated thousands and thousands of concussions before, is the big thing is we use it for clearance, okay? When I put your kid back on the ice, I know what factors that we have to get up to, okay? So baseline testing, of course we can diagnose a problem. We know a kid has a headache and their balance is off. We know all that stuff, for diagnosis purposes, for sure. But the big one that we use baseline testing for is, when we put them back on that ice or we clear that athlete, we know where they should get that to, okay? If we don't have those baseline tests, we have no clue where their normal is. In today's world, the biggest thing that I see is vision problems, okay? How many young kids nowadays have eye problems and nobody knows anything about it, okay? It's very, very interesting. And so I see a ton of kids coming in with pretty good vision problems, and I'm like, has your kid ever had his eye tested? Do they wear glasses? And the mom's like, nope, or mom or dad, nope. Nothing, never went there, and I'm like, I think you should, right? Because what I see could be a normal value for your kid, right? So very important to do, but the vision is a huge one, okay? But obviously, things like concentration, focus, and that are also very important as well, okay? Any questions for that? Pretty good? So baseline testing, we use it during clearance. Too many problems in today's world. Athletes are going back to sport when they're not healed, okay? It's the biggest thing I see all the time in my world, is an athlete will, sadly go to a clinic that sees one concussion a year, and they'll be like, how do you feel today? And the athlete goes, I feel fantastic, and they go back to the hockey, and all of a sudden they have all these horrible symptoms because they weren't cleared properly, okay? So very, very important, okay? So when we do baseline testing with you guys, this is an example of the balance test for people. Obviously when a person comes in for the first time post-concussion, you can see that that's clearly a problem, right? I don't need to have a baseline test to go, getting a 39 out of 100 is not a normal balance for a kid, okay? But what's really cool though is over time, I see that where that kid's balance is. That's a proper baseline right now for balance, okay? Because I can see where his or her normal is. So if something happens and they, want to progress to something, I know that getting up to that top score is where that athlete should be, okay? Same as for these cognitive aspects, as you guys can see here, that's a perfect baseline curve going right there. I know that that's what an athlete's normal score is for that person. Cool, eh? Okay? So when they get hurt or anything like that, clear as day, we know that these scores are going to be off. But we expect when we're putting them back onto a sports field or anything like that, they have to get back up to those good values, okay? Does that kind of make sense? Pretty good? Okay. So, what happens when we go back too soon? How many of you guys are familiar with second impact syndrome? Have you guys ever heard of that before at all? Okay. So, sadly, this is why we also do baseline testing, and this is why it's mandatory that we have to do these presentations and stuff like that. So second impact syndrome, or Rowan's Law, was basically created because of young Rowan here. Last year when I was doing these presentations, I actually had a very unique situation where one of the people in my audience actually was Rowan's neighbor. And so when this happened, the neighbor was very present in the situation with the parents and everything. So young Rowan was basically an Ottawa young rugby player who got 3 concussions in 1 week. Okay? The problem was is young Rowan never told anyone or said anything to anyone, nothing like that. She just carried on her day. Okay? So as you guys know, because you guys are concussion specialists now, how many days is that vulnerable window where I absolutely will never let a kid go back on the ice or not? 72 hours, that's right, okay? So what happens when you get multiple head injuries within that vulnerable window or that 72 hours is catastrophic problems sometimes, okay? Concussions, yes, can be a 30-day healing period with a lot of people. But the problem is if we don't deal with them appropriately, it can be life-threatening, okay? And so sadly with Rowan, she did pass away. So what second impact syndrome basically is that we get severe uncontrollable swelling in our brain, and basically it just cuts off the blood flow and we pass away and we die. So very, very severe stuff. Very important why we do not go back to sport in that vulnerable window. Even if your kid is asymptomatic though, but you still are like, holy smokes, that just happened. Don't do it. Don't risk it. Just sit it out. Sit it out a couple days, right? It's all good, okay? I can't emphasize it enough, okay? Real stuff. Okay? So these are just some of my patients actually that when I first started my career. Sadly, guys, what do you think the worst sport is for second impact syndrome? Sir in the back. Close. Okay. Mr. Blue. Soccer's good, yeah. But no one talks about this.
UFC.
Yeah. Fighting. Right? No one talks about the fighters. It's so crazy. Everyone's like soccer and football and hockey and all this stuff, but what about the guys that are literally paid $30 million to get hit in the face for a living, right? My boxers, all these guys, right? So how many times, if I'm not very good at fighting, how many times do you think I could get a concussion in one UFC match? A lot, right? Or a boxer? A lot, If I just keep getting up and I just keep going, bad things can happen. So this is a real deal, a real problem. When I first started my career, I did a lot of fighters and a lot of boxers. That was my main clientele. And it was very, very hard to deal with because these guys are getting paid big bucks to fight. They're sponsored by Nike and all this stuff. And you tell them, don't go back to your sport next week, and they're laughing at you, like literally. And these guys, they're young 20s, 23, 24 years old, young guys. But, it's their life, it's their livelihood. So these guys, as you guys can imagine, do you think they get headaches every day? Do you think that they have a lot of concussion problems? Yeah, they got a lot. You know, these are the people, sadly, that at age 40, at age 50, you know, you're hearing about a lot of the NFL players right now, but this is a real deal, a real population that we don't really think about. And obviously, I'm sure you guys have heard about CTE, which is kind of chronic concussions, right? This is a big thing with, you know, in my world, in the concussion world, that I get asked all the time is, you know, if my kids play sports and contact sports or not, is my kid going to get CTE? The answer actually is no, okay? CTE is a big research thing right now. We are finding it, you know, in the NFLs and all that stuff, of course. But there's a lot of, you know, stuff going on right now of if you play contact sports, are you going to get CTE every time? And the answer is absolutely not, okay? Contact sports do not equal CTE all the time, okay? It's a very, very interesting topic. A lot of the people in the NFL stuff and that, you know, there's obviously a lot of politics in this, but these are people that were dedicated to these research studies because they had symptoms of this already, right? So not necessarily an unbiased opinion, okay? So don't think that everyone's going to get this if they play contact sports. But if you are diagnosed with CTE, which is only diagnosable on autopsy, it is a real deal for sure. Okay? So what can we do to help? Obviously, you know, we're doing baseline testing tonight. You know, this is fantastic. You guys are making a really good step by even sitting here listening to me today, which is great. But my thing I always say to people, two things. As parents, we're the leaders of our family. You know, if something happens to Johnny or, you know, Tiffany, we need to be that leader going, it's okay to sit out a couple days. Let's just see how you're feeling. It's okay to do that. Why we do team testing, and even my kids that have had recent baseline tests because they've been a patient in the clinic or something recently, I still make them come do it because it's very important from a team perspective that they do it together, and it's okay to get injured. It's totally fine, but we need to kind of, you know, help assist that with coaching and trainers and parents and going, it's okay, all right? Everyone is going to have an injury. It's not a big deal, even if it's that big game. But we have to be positive on this, okay? Very, very key. The other big one that I always say to parents in that is whatever you guys are doing, okay? Concussions can be diagnosed very easily, okay? Your kid has a 10 out of 10 headache, there's clearly something wrong. But why do we use baseline testing? We use it so that when there's a clearance going to happen, we're going to go back on the ice, we have those markers. The key is, guys, I never will say you have to come to a cobblestone clinic. By all means, it doesn't matter where you go. People live everywhere, okay? The key is, though, if you have had a kid that has been diagnosed with a concussion, it's extremely important that you take your child to a place that sees a concussion more than once a year, okay? It's what they do, okay? I am not going to say we're the best, but take it somewhere with very good experience that knows what they're doing, because a proper return to play is absolutely key. If you're a hockey player or a center and you're twisting and turning and doing all that crazy stuff, that's what they need to do when they're cleared, okay? If they're going and the healthcare professional is basically saying, look at my thumb, they move it around 3 times, and they go, how do you feel? And you go, I feel okay. And they go, okay, fine, you can go back to hockey tonight. That is not a proper return to play. I see that all the time. I sadly have parents that will go to every walk-in clinic in the freaking area until they find the doctor that will do that so that they can go back and play that next weekend. Okay, I see it all the time. So don't be fooled by that. It needs to be a proper return to play, okay? Whether it's reaction time testing, these are called fit lights I use. Whether it's treadmill testing, you know, if you're a center, do you think you need a good cardiovascular system? Do you think you need to be trained? And do you think you can get your heart rate up to 150 beats per minute? Yeah, that's your normal for your sport. So if you're going to go back, you need to be tested on it, okay? You have to, all right? We do things like vision testing here, okay? Once again, following my finger 3 times is not going to do anything. It's not going to show you anything. I have tons of kids that are cleared to go back to sport, and they come in here for the first time, and I measure their eyes. Can you guys see that? It's kind of ish, okay? Well, put it this way. It's not a straight line, okay? This guy is a normal guy, where it's pure, nice, straight lines there, okay? That's good. Somebody that is all crazy and curvy and all this kind of stuff, that is not normal, okay? But this was a person who was cleared to play, okay? Once again, this is a reading test for someone who was cleared to play, okay? What reading test here, okay, do you think is normal, right? I hope all of you guys can answer this, right? This person was back on the ice, cleared by a health professional, okay? I couldn't believe it. I was like totally speechless. And the mom and dad, when they were into the clinic, it was not funny, but it was one of these situations where, you know, the mom and dad came in and they go, well, we were cleared on Monday, and so we went back on Monday night to play our game, and he suddenly just had all these horrible symptoms. And I'm like, I wonder why, because his eyes processing the world like that. And the mom and dad just couldn't believe it. They're like, no, he was cleared this morning, he was great, you know, no problems. And then, you know, we played the game, and instantly in 5 minutes, he was like throwing up and he was dizzy and all this stuff. And we're like, that kind of makes sense. If you perceive the world like that, how are you gonna feel, right? Not very good, okay? So very important, okay? Obviously balance stuff is good too, okay? So really key this season, get it diagnosed, get a good proper return play, okay? So we're gonna do some fun stuff now, okay? So myth number 1, all right? Concussions can only happen if you're knocked out. No. Double negative. Yeah. All right. Awesome. 90% of the time, we never have loss of consciousness. Okay? Never. All right. So do not think that even small little blows can lead to problems. Okay? But 90% never. Okay? Kind of crazy. So helmets, visors, and mouth guards. This is a great topic. Okay, sir, if I have the new $1,000 Bauer helmet, can I still get a concussion? Yes. Okay. Very, very important. Helmets, what are they good for? They're good for preventing a fracture. Okay, that's what a great helmet's designed for. It will lessen the blow a little bit, don't get me wrong, for sure, especially some of the really nice helmets out there. But if you're gonna get a concussion, you're gonna get a concussion. Okay? Mouth guards. If I wear, do all your kids wear mouth guards? No? Cool. Okay. Well, guess what? I bet you will after this. So, cool fact. This is brand new, kind of about 2 years ago now. Mouth guards were same as helmets. They were known not to do anything really. You know, they protect our pearly whites, but besides that, they really didn't do anything major. But this is a really cool stat. Up to about 30% of people that wore a mouth guard did not get a concussion that season, okay? So as a father myself, does my son wear a mouth guard? Heck yeah, okay? So something I recommend, and the cool thing with this study is it didn't even have to be a custom mouth guard. It could have just been the Canadian Tire Special. But putting something in your mouth basically stabilizes your jaw, and then that acts on your neck to help prevent that whiplash. Okay, so really, really cool stuff. I highly recommend it. And once again, doesn't need to be the $1,000 one from your favorite dentist. Any dentists in here? Okay. It doesn't need to be that one, okay? But really, really cool, all right? Obviously, the big thing with helmets and mouth guards, I can always say that to parents, is it does not need to be the most expensive one. Okay? The best helmet or the best mouth guard is the one that fits your kid properly. Okay? I have seen bazillions of football helmets out there that they're like, oh, this one's the new, you know, whatever extreme. But it flops around on the kid's head. Sometimes the less expensive one, if it fits it better, that's the one you guys need to pick. Okay? Sound cool? But mouth guards is something I do recommend if you want to wear it. Okay? So, do I need to hit anything? to get a concussion? Good job. Okay. Also an answer. Most people, especially my hockey players, think I need to go head first in the boards. Okay. Remember from earlier in my presentation, very important, it's all about the whiplash of the head and neck. Okay. You do not need to make contact with anything for concussion. Okay. It's all about that shaking of the head and neck. Okay. That is key. Okay. You do not need to hit something. Okay. We did cover this earlier. Are concussions a structural problem, guys? No. Okay, what are they? They're a metabolic problem. Okay, so very, very important. You know, if you go for a CT and MRI and it comes back negative, it does not mean that you do not have a concussion. Okay, very, very key. I get told this all the time. Okay. This is a huge one. All right. With concussions, okay, do you think locking your kid in a dark room is a successful strategy for recovery of concussions? No, okay? It is actually one of the worst things that we can do, but it is hands down one of the biggest myths out there. And you will see people still do it to this day, is I will lock my kid in the room, I will take away their electronics, I will not let them go to school, anything like that, okay, until they start to feel better. It happens all the time, okay? With concussions, we want to gradually reintroduce people back into their normal life, which is what I will show you next, okay? But never, 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 guys, lock your kids in dark rooms, okay? Because I'm freaking telling you, I see it all the time. I had a girl a couple months ago, super high level soccer player, about 15 years old, and her healthcare person, she was from Burlington, told her to stay in the dark room until she started feeling better. No word of a lie. The girl was in the dark room for 6 months, okay? As you can imagine, a 15-year-old girl, okay? Prime social time of her life. And that's what they told her. They said, if you feel worse, go back to your dark room. Oh, symptoms came back again, get back in there. And that was their treatment strategy for 6 months, okay? She came and saw us, and what do you think the first thing it was that I did with her, right? Said, yep, keep in the dark room, right? It's crazy. What was that? So number one thing, for the first vulnerable period, 72 hours, yeah, we're gonna downgrade a person's life 100%. We're gonna calm them down for sure, take away electronics. But after that, we want to introduce things again, okay? We want to get people active again. With every concussion, we're almost done, guys. You guys are doing great. With every concussion we're doing, we go through this stepwise approach. Okay, and I'm sure you guys have seen this before. So with school, we basically, level 1 is kind of our first 3-day, 72-hour period. Okay? After that first day, we start getting them to do stuff. Okay? Once they're feeling better, we get them back into school. Once they're feeling better, we get them back into more school, okay? Every step, typically, if things are going perfectly, will last about 24 hours, okay? You know, depending on the kid, it will change for sure. But if everything goes great, we do 24 hours per symptom. But what happens if I introduce a half day to school to a kid and he gets symptoms? What do you think I do? Do you think I just keep going through the stages? You go back a step, right? You go back to the previous step. So we stay in the stages until they have 24 hours of no symptoms at that stage, and then we go into the next one, okay? Same as for sport, okay? Am I gonna just throw a kid back in hockey practice when he just had a concussion? No. But am I gonna get him active around the house? Yes, to his symptom levels, or her symptom levels, okay? Once around the house is feeling better, am I going to get him back into hockey practice? Yeah, I am, for sure. If that starts going better, then we ramp up the intensity a little bit better. You know, so maybe we put him at 30%. How did that feel? It felt great. Okay, let's go to 50% now. How does that feel? No problem. Let's get you back into a scrimmage. And we go from there, okay? It's always a graded approach that we do, okay? Sound good? Does that make sense to everyone? Pretty good? Okay? Every single concussion patient that's been diagnosed needs to go through these symptoms, okay? We never jump 2 steps, or even if the kid is doing great, we don't just ram it through, because every time we increase load, something can happen, okay? So, really good. All right, so last, guys, if you guys do have any issues with anything this season, you know, twisted ankle, elbow, whatever the heck it is, we do offer next day care for every athlete, okay? Because you guys are partnered with us, take advantage of the program. It is a fantastic program, okay? Cool. You guys did wonderful tonight. Good job. Well, thank you for listening, guys. Does anybody have any questions at all? Yeah.
What is the protocol on like pain meds after the thing is suspected?
That's a great question. So, I always recommend, so typically with concussions, you're gonna get like a neck whiplash, right? So for a concussion, you require 100 G's of force to get a concussion, okay, 100, okay? To get a neck whiplash, you only require 5, okay? So with every concussion, do you think you get a neck injury? Yeah. So I have some really bad neck injury kids that I will recommend take Advil or Tylenol 100%, for sure, okay? The biggest problem that you have to worry about with pain medication post-concussion, which I don't recommend, like unless they have a lot of physical pain, is because you're gonna mask their symptoms, okay? So when I'm trying to tell a guy, how do you feel when you watch TV? How long can you watch TV for before your symptoms worsen? If I give my kid no word of a lie, I've had kids that are taking 15 Advil in the morning and 15 Advil at night, right? And they think this is a normal thing. Okay, is you're masking the symptoms that you need to kind of know about, okay? So for me, am I gonna recommend to that kid that has a neck injury, maybe some gentle stretches to get his neck moving? Am I gonna say to every one of my concussion patients, I say, every night before you go to bed, you're gonna put ice on your neck, every night, for a week. Every single patient I see, even if they're like a 1 out of 10 problem, I say for a week straight before bed, you're gonna put an ice pack on the back of your head. It's my protocol I use, every person. So I try to do natural strategies first with people before we resort to pain medication. Because masking your symptoms is a bigger problem, right? Because every time you have a problem, you're like, I better pop 4 Advil, and then you just get into this negative cycle, right? But if you try these natural things first, and then you're still in disabling pain, then we will introduce the medication, for sure. Does that make sense? Or, you know, another big one in our clinics is nutrition. You know, can you take an anti-inflammatory nutritional diet? Yes. You know, turmeric and all these kind of things are very good anti-inflammatory things which can help with pain naturally, right? Yeah, great question, great question. Yeah. Yeah, anybody else?